When developing a product, manufacturers need to determine if there will be a large enough quantity of potential buyers. The smart toilet has been designed with the elderly population in mind. This toilet is currently in prototype phase but will be released to the public soon. In essence, this particular product runs all sorts of urinalysis, including medication monitoring, content, etc. There's a built-in Wi-Fi device which links the toilet to the physician's office. The physician can monitor instantly if a patient is being compliant with medication, either not taking, taking too little, or in some circumstances, taking too much. Also, the toilet will scan for any signs of illness as urinary tract infections are problematic in many populations of elderly. Another technology that has actually been developed is the remote surgical robot. The manufacturer is currently working on the next generation of surgical robot, and thus its inclusion here in our future technology PowerPoint. One of the most widely used surgical robot systems is the Da Vinci system. While the surgeon maintains complete control of the robot, the surgeon's movements are mimicked in much finer detail with the machine. This allows for much smaller incisions, less risk of infection, and quicker recovery times. One model currently in prototype phase allows a surgeon to access a robot via remote-based computer and perform a surgery thousands of miles away. The makers hope that this will reduce wait times, reduce costs, improve access, and increase quality. Hospitals are expensive. How many of us have had to visit a hospital only to be shocked at the price tag? On the flip side, though, most hospitals want what you want. That is, a speedy discharge. Reason for this is that as a result of prospective payment systems, before you step into the hospital knows exactly how much money they are going to get from the insurance as a result of your admission. Imagine that you went in for a procedure that required 2 days stay. The insurance will pay for the 2 days and nothing more. As a result, at hour 48, the hospital wants you to be discharged. Why? Because at hour 49, you are now using resources that are not paid for. Imagine all the nurses, nursing assistants, lab techs, etc., who are involved with your treatment. If you stay later, they are no longer being reimbursed for their services. To leave a hospital, one must be discharged by the admitting or attending physician unless the patient decides to leave AMA or against medical advice. If this is the case, most insurance companies will not pay the bill. Again, how many of us were ready to leave the hospital, yet had to wait hours for the physician to visit and discharge? Now, hospitals have teamed up with manufacturers to produce video screen robots on wheels. A physician logs into the robot remotely, maybe from his or her office, and with the use of video cameras can now visit his or her patient and discharge them appropriately. The robot knows how to avoid running into objects, and it is as simple as running a remote control car. The last technology to discuss is that of online physicians. While most physicians have an online presence, maybe through social media, some physicians are experimenting with office visits via Skype or other video conferencing software. Some individuals may be too sick to visit a physician or simply want to avoid waiting in line. With an online visit on the horizon, you could log in at your time and your smartphone would alert you when your physician was about to connect. These are just a few examples. Who knows what the future will bring?